A review into Nelson Hospital has landed on desks, highlighting significant staffing shortages and infrastructure challenges. Dame Helen Stokes-Lampard is with us from Health New Zealand to talk about this. I will outline a little bit more about what's in the report for you this morning so that everyone is aware. So doesn't raise or suggest any real solutions for how the problems will be addressed. It had led to wait lists blowing out. This is the shortage of staff, people waiting months for treatment at the hospital, a severe shortage of senior doctors, especially in general medicine, obstetrics and gynecology, paediatrics and vascular. A whole bunch of issues going on there to contend with. And Dame Helen Stokes-Lampard's with us from Health New Zealand now. Good morning.
Kia ora, Ryan. Good morning. How are you?
Good, thank you. Why? So you guys ordered this report, right? This is a you thing. Why is there no solutions?
There are quite a lot of solutions in there. The report contains a long list of recommendations of things that should be done next, particularly looking at some of the infrastructure challenges at Nelson and Marlborough, but also looking at the workforce in detail. There are a whole heap of things identified as challenges, historical issues, some things that'll be quick fixes, but some that'll take longer.
Okay.
Investment will be required to enable some of these to move forward.
What's one quick fix you're getting out of this, one quick solution?
Actually, communication is one of the quicker fixes. A lot of the staff felt that they hadn't been heard and when they'd raised concerns in the past, and actually improving communication internally within the organisation will certainly help that, because there are a large number of people doing remarkable work at the hospital, and indeed the care that's delivered is largely of a very safe, high quality standard.
So the quick win, you said this is a report filled with solutions. The quick solution is to talk to your staff.
There are several in there. You're preempting me. There are an awful lot of things that we can do in there. Some of them will involve restructuring the staff. The clinical and management structures in there have not evolved as the large population has expanded in the area. As people have had greater health needs, the population is sicker than ever because people live longer. And it's a great success for our healthcare system that people are living longer, but they live longer and have a lot more long-term conditions which need more care. So the people have been trying to do more and more, but with insufficient resources and infrastructure, and that is going to take some time to address. But also there are process and system things and communication things that can be done relatively quickly, which will improve things for all.
So what's the number? You know, we had this big report done. How many extra senior doctors do we need? How many extra junior doctors do we need?
The focus is more on junior doctors than on additional senior staff. Nelson has an interesting model, which is quite unlike most of the rest of the country, which is they were very proud of for a long time and served them very well, which was very much a consultant-led model. But we need to bolster their numbers of junior staff, but we also need to bolster the numbers of advanced other staff, so advanced nurses, advanced allied and healthcare
how many
staff. We haven't specified how many. What we've asked the team to do is look closely department by department. This, if you remember, this was a rapid review looking at is the hospital safe? Are they delivering quality care and is it safe? And the answer to that part is
how long did it take?
But it needs to go. Well, the new implementation group that's going to be looking at this will be convening on Monday. So it's starting immediately. And indeed, the regional executive, he's going to be staying on there today. He's been there for several days this week and is starting conversations now. But the meetings will be convened formally on Monday, giving people time to assimilate the contents of the report.
When did you request this review?
The review was requested on, I think it was the 3rd of April was the day that the 3rd or the 4th of April when it was all initiated. And there was a 3-week intensive period where myself and colleagues were on the ground speaking to patients, speaking to staff, finding out what was really going on that had led to the concerns being raised. Then there was a time period of consolidation where we were doing the background research, finding the evidence to support or refute what are the facts behind what people were feeling and seeing. And then the report was written and presented yesterday.
Appreciate your time this morning. Dame Helen Stokes-Lampard with us from Health New Zealand. Right, if you got feedback this morning, Ryan at nzherald.co.nz. Listening into that was Katie Ben, who's an anaesthetist at Nelson Hospital and joins us on the line for her reaction this morning. And we'll get to her in just a few moments because we need to understand what's going on the ground, what the doctors and nurses there are feeling. A rapid review, I don't know. Yes, it started in April, but a rapid review, what's the point of it if they can't tell you how many doctors you need, how many extra doctors you need? How much did the review cost? Was it worth the paper that was printed on?